But,
Wow.
you know, majority of the puppy dogs we'll use our ultrasound for is, let's say we want to draw some urine, is just to find the bladder. And see that little black spot there?
Up here in the top, right here?
Right here.
Oh, okay, gotcha.
That is Bo's bladder. So the way these crystals are, the sound basically is the sound waves are bouncing off tissues coming back. So sound waves have a hard time passing through air. So air would be really black, or it would be very hard to even see. Any kind of fluid is going to show up black. So what we're seeing here is this is closest to the probe right here, and then the farther we go away is we're seeing tissues that are bouncing sound waves back. So we go in about 1 centimeter, we hit the bladder, and it's bouncing sound waves back. And then we're seeing the colon, this white line here underneath there, and that is basically bouncing sound waves back. The other side of the colon is here. Okay,
so you would use it for bladder, colon?
Bladder, and it can be used for, I mean, in the right hands, this is a wonderful machine. To give you an example, if we're doing cardiology, cardiac ultrasound, we actually use a service, a cardiologist out of Cleveland. She comes with her own machine, and she'll do the cardiac ultrasound.
Okay.
With her own machine, and she'll basically interpret it. Because with that, you're looking at, I mean, we can kind of take a quick look around in Bo. What we're seeing here is a little bit of Bo's liver. So let's say, let's say you want to take a liver biopsy. Now, the old way was just to take a biopsy, get a piece of liver. Well, with the ultrasound, you can actually look at the liver and you can say, okay, you know, this area of the liver doesn't look right. So if I'm looking for a liver disease, I ought to be biopsying the part of the liver that looks diseased. So with an ultrasound, you can actually take your biopsy instrument and guide it to that part of the liver. So this is all liver here. And
so most of the time it's used for abdominal situations?
Majority of veterinarians majority of your private practitioners, guys like me, are not going to be doing cardiac ultrasound.
So you're doing most of the things that would be involved in the abdomen?
Exactly. Okay. Exactly. So most of us can find the kidneys, look at the kidneys, look and see if there's any abnormalities in the kidneys. Boils down to the more you do, the better you get.
Hey, what about to find if there's puppies?
That would be relatively easy. Puppies are kind of cool because they have a heartbeat.
Sure, so you can see them.
And so we would use the machine to determine A, is she pregnant, and B, are these babies live? Okay.
And how many there are?
Not so easy with an ultrasound. We can let Bo stand up. I think
I think that's good. Thank you. Thank Bo for us on that. I don't think you really particularly like that, but at least it was a good idea.
The biggest reason you can't use ultrasound to determine how many is you got the uterus
on top of each other.
They're going to be moving around, and you can easily. So if we're going to count puppies, we'll use an X-ray. Okay.